Okay, so today, Dr. Sarah and I are going to be sharing about the early signs of autism, as well as the diagnostic process. My name is Dr. Logan Hoppe. I am the MeBe Regional Director in our Dallas-Fort Worth area, and I'm also joined by Dr. Sarah.
Hi, I'm a licensed psychologist in BCBA out in Denver in private practice. I'm also on the Autism Society of Colorado's board of directors as well, and I'm just happy to talk with y'all today.
Okay, so I'd like to start our webinar today by sharing some information about what typical development looks like. The CDC has developmental milestone information available on their website for ages 2 months all the way up to 5 years of age. But I've selected a few early levels for us to focus on right now, specifically highlighting those milestones related to communication, social and play skills that we typically see are affected or we kind of see in autism spectrum disorder. So at 6 months, most children will recognize their family members. We should hear a lot of vowel sounds as well as laughter from them. And then we should also see children at this age attempting to reach or access toys in their environment. At the age of 12 months, we'll start to see some of those skills increase. So we might start to hear some words like mama or dada. We may see that our children are interested in playing social games with us. So things like pat a cake or peekaboo. And then by 18 months, many children will be using different types of gestures like pointing. They might be interested in looking at books with us. And then we may start to hear a lot more single words from them, as well as see the ability for them to follow directions like come here or sit down. So if you have concerns about autism, you might notice some of the following at these age intervals. So at 6 months, we might not see a lot of smiling from our children. We might also see that when we're talking with them or singing to them, that they're not really making eye contact with us. And then we might not really see them engaging with toys. By 12 months, we probably won't see gesture development. They might not be able to say mom or dad. And then they may not really display any interest in engaging in some of those social games I mentioned previously. And then by 18 months, where we would typically see that children have words, that we might not see any language development at that point or minimal language. And then we may also see that they're really not able to even follow simple directions. So I like to kind of caution families that skills in boys and girls do develop at different ages and at a different pace. So boys are typically slower to develop motor skills as well as communication skills. And so to give you an example, at 16 months, most girls will have a vocabulary of close to 100 words, where boys may only have 25 to 30 words. On the other hand, while girls are quicker to develop communication skills as well as pro-social behaviors like sharing, they are typically slower to develop self-care skills. So this might be things like eating or dressing. And so while autism still occurs in both boys and girls, research does indicate that sometimes girls receive that diagnosis later. And again, that could be because they do have those communication skills that sometimes boys do not. So you may ask, what is my role as a parent in tracking my child's development? And so it is basically that, to track those developmental milestones and then to report on any concerns that you may see or any delays that you might notice in your child. And then on the other hand, your child's pediatrician or primary care provider, their role is going to be to help you screen your child for developmental disabilities like autism. And that might occur anywhere as early as 9 months or up to 30 months. And so they'll do these developmental screeners, which we'll talk about in a couple minutes, to determine if a more formal developmental evaluation is needed. And I always like to tell parents that no one knows your child better than you. So if you are noticing those concerns, please talk to your healthcare provider. So the CDC has a really great milestone tracker app. It's available on iPhone and Android. It also comes in English and Spanish. And so the age ranges for this app are between 2 months to 5 years. And this can be a really great tool to help you track and monitor progress. And it can also be a nice resource that you can easily share developmental information with your child's pediatrician during their well visits. So I know I mentioned developmental screeners a minute ago, and so I want to talk a little bit about what those are. So these are typically performed usually between the ages of 18 months to 24 months at a well-check visit with your child's pediatrician. These screeners are used to look for autism or other developmental delays that your doctor may be concerned about. And so your child's pediatrician may ask you some simple questions about your child's communication skills, how they use gestures, if they're engaging with toys, as well as how they engage with others. These screeners only take typically just about 5 to 10 minutes and are pretty easy. And some common screeners I have here are the MCHAT, or the Modified Checklist for Autism in Toddlers, the Social Communication Questionnaire, as well as the Infant Toddler Checklist. So once your pediatrician gives you this screener, they should also provide you screener results. And so these results will give you a risk score. And this basically means how probable it is that your child may be at risk for autism, or again, other developmental delay. So if you get a risk score that indicates moderate to high risk, your pediatrician may encourage you to move forward with scheduling a full diagnostic evaluation. There are a few websites where you can take the MCHAT for free. So Autism Speaks, I think, has this available for parents on their website. So if you are a parent right now and you're saying, I have some concerns about autism, or I think my child is showing some developmental delays, go to their website, take that screener, and then you can take the results of that, if it is showing that your child is at moderate or high risk, to your child's pediatrician. So now I'm going to turn it over to Dr. Sarah, and she's going to talk a little bit about next steps if you do have concerns about autism.
All right. So what happens next? This is typically a conversation with your pediatrician, and it could either be you bringing up concerns or the pediatrician bringing up concerns. Some parents will tell me that they feel surprised, by their pediatrician bringing up concerns and why did this happen? What did they see? What led to that? And I think that can be helpful to know. At the same time, also helpful to know that you can bring up these concerns and you don't have to feel like you have to wait for the pediatrician to bring things up, or, share similar concerns as you do. So why might a pediatrician bring up, maybe an evaluation is needed or make a referral? Usually that's because they're looking at things like those questionnaires. So there's one called the Ages and Stages questionnaires. Sometimes they pull from that. They pull from the MCHAT, or maybe you're telling them, my child is not walking or talking or looking at me and things like that just yet. They may also observe things during a doctor's appointment, actually in the clinic. And so they might see that your child is struggling to make eye contact, or maybe there's a tantrum or some behavior during that appointment that makes them question if maybe an evaluation is needed. And you could also be telling them things that are raising red flags for them that might lead to that referral. Reasons that you could talk with the pediatrician broadly, if you're seeing developmental delays, or if you already have concerns about autism, that would be, that time to have that conversation. If you feel like your child's not responding to therapies as you're expecting, or maybe you're really wanting to get connected with therapies, but you're not sure what's appropriate, then asking for an evaluation could be a next step to accessing that. My mouth's not working. Also, maybe you're telling the pediatrician you are having significant meltdowns at home. They're lasting an hour and you're really wanting help. Well, an evaluation, could be something to get you that next step for support for you. Next slide. Perfect. So how do you have that conversation with the pediatrician? There are some things that are helpful to have. So especially since most doctor's appointments or well-child checkups are such brief appointments, I do recommend bringing videos of things that maybe your child may not show during that appointment, or you just really want your pediatrician to understand what's happening or what's hard at home. You could also bring things like MCHAT results, like Dr. Logan mentioned, milestone trackers. So I do recommend tracking, at what age your child met most milestones that the CDC would, encourage you to track. And then I also recommend before you have that conversation, maybe talking with trusted friends, people that might have walked kind of a similar path. If your child is currently receiving any therapies, especially early intervention therapies, I would talk with those providers and they can kind of help you understand how to best have that conversation. And also think about what you're running from it. And I say that because sometimes a pediatrician will say, oh, let's wait and see. But you know your child best. And so what I recommend is really following your gut. If your goal is to walk away from this conversation having a referral in hand and maybe a phone number or different options like that, then make sure that you're advocating and getting that out of that conversation. Next slide. So these are some things to think about. I do recommend thinking about these before you have that conversation, or maybe while you're waiting for your evaluation, if you've already got one scheduled. Knowing the signs of symptoms is the signs and symptoms of autism is very helpful. I will say that what's on this slide though is a very broad kind of overview, and the way that these things can present or look over time can also change as your child gets older. And so for some of these, they're really more common in toddlers. And what you might see are things like missing eye contact, not responding to their name, preferring to play by themselves. And if you join their play, maybe they're a little bossy in play, or they're, kind of pushing you away or going and doing their own thing. Sometimes parents describe their toddler as being in their own world, and that's something that we can see in this kind of social communication area. Trouble with social cues, reading body language, understanding how people are feeling, and kind of offering comfort and showing that empathy. Maybe they're not excited by other children just yet, or maybe they're really struggling to play, maybe creatively, or their play is simple and it's kind of repetitive, lining things up and stuff like that, as opposed to playing with you and playing creatively. May also need their name called several times, may not return greetings, those types of things. And if you have a verbal toddler, it could also be that they're struggling with conversations and kind of that simple back and forth chit chat like we would expect for that age. Next slide. So this is a second domain of autism that's required for that diagnosis. And I'm going to try to not use a ton of kind of professional language or jargon, but it's hard because this is also part of the diagnostic criteria. And, it can be kind of hard to put these into simple language or plain language, I should say, for people if they're new to the diagnosis. But we call this restrictive repetitive behaviors. And so these can be things like repetitive movements, repetitive language. It's not just hand flapping, which some people think about with autism. It can be subtle things that also look like tics, like maybe grimacing, some kind of finger twisting or flexing and things like that. You might also see repetitive play or gibberish, repetitive noises. Maybe they're echoing things that you're saying as well. Sometimes they can seem attached to certain objects. And so maybe they're carrying around a particular toy or object they just really love, but they can't leave the house without it, and it's hard for them. You might also see some of their interests feel somewhat intense or consuming, and maybe they're spending a lot of time with one type of play, and it's hard to transition them to something else. Oftentimes we see, especially in toddlers, a lot of tantrums or longer, more intense meltdowns because there's some inflexibility there around maybe a routine is changing, maybe expectations have changed or the play has changed, and that can make them frustrated. And then we see these bigger kind of challenging behaviors, so to speak. You also tend to see sensory seeking behavior, like crashing into things, rubbing, touching, feeling, smelling, licking, that type of stuff. Might also see sensory avoidance and maybe covering their ears with loud sounds, not liking the way certain clothing or maybe daily grooming activities feel and things like that. Let's see if there's anything else important I wanted to touch on. I think that's most of it. Some of the repetitive play that can be helpful to know, it's not just lining things up. It can also be dumping and stacking over and over, opening and closing things, just things that feel like they're happening over and over and they're having a hard time expanding kind of beyond that play. All right, next slide. So with all that said, how do you talk with your pediatrician about these things? And maybe on the other side, if the pediatrician's bringing up concerns and you're not quite sure what to make of it, what do you do with those feelings? And however you're feeling is valid. It's okay. Some parents are surprised and some aren't, and they're like, let's do it. Let's move forward. And some feel like they need extra time to process what they've just been told and what's been recommended by the pediatrician. And that's absolutely okay. I put this slide in here because I want you to know that it's okay if you need a second conversation. It's okay if you need to talk with family or talk with therapy providers and understand this recommendation before you go forward and, kind of seek out an evaluation, because the evaluation process, there's a lot that goes into it, and we want parents to feel ready when they're taking that step. And if you don't feel ready, then advocate for the information that can help you feel ready and help you understand it. All right, next slide. I also put this in here because this is a common thing that I hear from parents during the evaluation process, and that, I do see a lot of older kids and teenagers, and parents have told me, we asked all throughout our child's childhood, especially when they were toddlers, for an evaluation, and we were told, let's just wait and see. Again, your child best. You are your child's best advocate. Follow your gut. If you feel like an evaluation needs to happen, push for that. Help your pediatrician understand why that referral is important to you, and why maybe that wait and see kind of approach is not necessarily helpful. If your child needs specific therapies and specific support, we won't really know that unless we do an evaluation. And so it could be, that wait and model, or let's wait and see, or kind of wait to fail type model that we even see in schools as well, could be delaying vital intervention that could help your child. And then also, let's see. Oh, Logan, are you monitoring comments while I'm talking? I forgot to ask that.
No, but I think we just had someone, let's see. Oh, I think we had someone just raise her hand. I think it was Marguerite. If you have a question, if you will just post that in our chat, you will not have access to sound or video. So yeah, sorry, if you have a question, if you'll just post that in the chat box.
Perfect.
And also, sorry, Sarah, I'll see if that pops up in a second.
Yeah, you're totally fine. The one other thing that I just thought about that I wanted to touch on with this is it's also helpful to think about what could be a developmental stage versus what is a more persistent or ongoing delay. And so it's probably helpful for your pediatrician to know, hey, they haven't just been doing this for 3 months. This is 6 months. This is a year. This is 5 years, that we're really needing support. And this is not just a stage, and we don't want to just wait and see. This is a more ongoing thing that we really want support with. Next slide. So who does an evaluation? I get that question a lot because I feel like it can be pretty confusing, and you're not always given a lot of direction. You're kind of told sometimes, go get an evaluation. And it's like, who does that? Who does evaluations? So more often than not, it's a licensed psychologist. So it's someone like me with that doctoral level training and heavily supervised experience in diagnosing autism. Usually it's that type of provider. You can find a licensed psychologist in community mental health agencies, in private practice like myself. ABA companies also sometimes offer that service as well. And sometimes it's within, group practices of different clinicians. Sometimes it's also diagnosable by a developmental pediatrician. Those are much harder people to come by. They're just really, I think we have like 5 in the state of Colorado. There really are not many. If you have found one, hang on to that person because they're very rare. They are out there, but they tend to be at places like, out here in Colorado, like Children's Hospital of Colorado. So like bigger kind of clinics like that. And then sometimes a neurologist can also diagnose it. It really just depends on that provider's training. Sometimes even a psychiatrist will diagnose it. I don't always recommend that route though, because they're not usually doing as comprehensive of an evaluation as maybe these other 3 types of clinicians are doing for autism in specifically. If you are looking for somebody, to do an evaluation, you can certainly reach out to MeBe's Family Service Liaisons. I'm also happy to help connect you. I have a pretty wide network even outside of Colorado that, if I'm not able to support you, I can hopefully help you find someone as well. Next slide. So what do you do while you wait? I know it's really hard. Sometimes, you might make a call and get an appointment for an evaluation, and it might not be for 6 months. It might not be for 8 months, or you might wait even 2 months, and that feels like an eternity. And I totally understand. There are things that you can do while you wait, though, that can be helpful for that evaluation process when that time does come. So between the time that you're referred and before your appointment, I recommend writing down notes. I often have families that email me things that they want to talk about or that they've thought of, and just things that they're afraid that they might forget when we're actually meeting for the evaluation. Write down your questions. Like I said, recording videos can be very helpful, especially as a diagnosing provider. If there's something I don't see during an appointment, but it's important to you and it's a challenge that you want help with, having videos is critical for that, because you can only describe a behavior so well. I really have to see it in some capacity. Connect with people, if you're comfortable talking with friends or family and trying to find people that have been through a similar shared experience, that can be really, really helpful and might ease some of that anxiety about the evaluation process and what to expect. You can also learn more about the developmental milestones. You can certainly learn more about autism, but I also caution you with that, because some of the stuff you Google may not make sense until you're in that evaluation process. And some of it can sound a little scary or kind of daunting without a provider that's giving you context around those things that you're reading. And so I actually don't recommend Googling a whole lot about autism, but learning a little bit can also be helpful as well. And then one of the most important things is self-care. So take care of yourself, maintain the routines that you have at home with your child and your family, and just kind of keep chugging along and make sure that you're taking care of yourself in that process before you see someone. Next slide. All right. So what does the process look like? I am so excited to kind of demystify this. It shouldn't be a scary process, but it is comprehensive for a reason. It is kind of labor intensive for everyone. And that's because it's really important that we're spending the right amount of time to really get to the bottom of what's happening. And we want to do the job well and accurately. And so the process should always start with what we call an intake session. And that's an opportunity for you to talk about what's been challenging and maybe some of the delays that you're seeing and just those kind of patterns of things over time. A big part of that conversation should be talking about what are the symptoms of autism. And the clinician should be asking you very specifically, things that could align with those symptoms and asking for clear examples so that they're getting kind of an accurate picture of your child. They should also talk about medical concerns or conditions. If a child has a genetic disorder or something like epilepsy, even like a neurological difference, that can impact how we're looking and kind of doing the evaluation process and really trying to rule out, is this due to a medical condition or is this due to autism? We're talking pretty heavily about developmental history, progress in therapies, even your family histories. Is there a history of trauma or autism or learning disabilities, things like that could kind of help us work with your child and kind of understand, that history. Every clinician should also want to know what your child is good at. We enjoy having conversations about, what are your child's strengths? What do you love about your child's personality? Because that also helps us know what to recommend at the end of the process. And then your child best. So how your child learns and how someone should work with your child during an evaluation. And that information is really helpful. And then the last area is current living situation and support. So, are you a single parent that could get help getting connected in the community, or is there another resource that could be helpful? All right, next slide. So the intensity or kind of how long testing lasts sometimes surprises parents. What I will say is this depends on your child's age. So for me, when I see a child under, I would say 6, I'm probably doing about 2 to 2.5 hours of testing. If I'm seeing a child that is older than that, 6, I see through 16 years old, usually we're booking a 4-hour evaluation session, and we're doing a lot during that time. For little kids, I don't try IQ testing. Some providers do, but it just doesn't tend to be super accurate, especially if there are language delays or, things like that. Usually I'm doing a test of developmental abilities to kind of gauge, where your child's skills at in comparison to where we would hope for them to be at that age, and what might they need help with. Almost always the provider is doing something called the ADOS, and how the ADOS looks depends on how verbal your child is. So if you have a toddler, we're doing a lot that's involving you, because we want to see how your child plays with you and talks with you and seeks you out and things like that. If your child is, usually I would say 6 and up and pretty verbal, then we're doing a version of the ADOS that's just one-on-one with the clinician, and you're kind of out of the room, and that gives us a gauge of that child's skills. We're also looking at how your child perceives or kind of understands social cues, how other people might think, what could be happening in certain situations, that type of stuff. Usually there are questionnaires or rating scales. Depending on the child's age, they may fill some out, but we may have the school tell us what's happening at school, and we may have you fill out a variety of questionnaires to tell us, what kind of skills you're seeing at home. And then sometimes there's some play observation too. So like I usually spend about 15 minutes at the beginning of a session just hanging out with the child. And that's really to build rapport and just kind of see how they play when there's less structure. All right, next slide. So the results. This is where the clinician should help you understand not only the results of the evaluation, but also why recommendations are being made or why certain ones are being made. Depending on the provider, this could happen the same day as in-person testing. It could also happen usually within 1 or 2 weeks after that in-person testing. And it can depend if your clinician needs more time to kind of go through the file to come up with their understanding of your child's needs and things like that. That could delay that. Sorry if you hear my dog barking in the background. One thing or a couple things that I want to touch on with this is, don't be afraid to advocate or ask for another session with your clinician. So it doesn't have to be a one and done type thing. I always let families know that they are welcome back at any point if they need help processing the diagnosis, understanding the recommendations. If there were any concerns that weren't addressed during the process, let's meet and talk about it. Also, don't be surprised if you remember like 10% of what was talked about in this results discussion, because it can be a lot of information. And I can sometimes kind of see in parents that their brain has kind of slowed down and that they're not processing like they were before because they've just heard that their child has autism. And there can be a lot of emotions that can come with that. And so be kind to yourself. The written report should always follow this in-person or this results discussion, and should hopefully help you remember some of the things that were talked about. And it's okay if you're feeling overwhelmed. I think that that's normal and that's okay. Just ask for support. Next slide. All right. So I mentioned the report. This should always follow any evaluation, because this is your formal documentation of any diagnosis and recommendations. This is what we call your kind of final product that you will take to other people to let them know, the diagnosis and recommendations. So it is really important. It should tell you all the results of the tests that were given. It should help you understand any diagnosis by having a summary section. And then it should also have individualized or personal recommendations for your child based on the results. Ideally, it's also communicating how your child learns and your child's strengths, because those are so important for the treatment steps that might follow. It's also important because you need it for insurance. So that's your formal documentation to tell insurance, hey, authorize these services. Otherwise, it might be hard to access services if you don't release that report to insurance. It also helps you talk with your pediatrician and follow up, especially if there are any medical recommendations after that evaluation. And it also can inform school services. And something important to know here is that we call it a medical diagnosis of autism. A medical diagnosis does not automatically entitle your child to specialized school services, but the school has to consider it and has to consider an evaluation if you're requesting one for school services. And so the report is also very important for that. The last thing I want to touch on with the report is how it can feel reading the report. It is a lot of information. It can be overwhelming. It can be an emotional experience. But knowing that the report is written to help your child access services and to help everyone understand why a diagnosis was given can sometimes help with those emotions. Next slide. So I didn't mention what I do. I clearly, I do diagnostic evaluations. I have specialized, I would say, for probably 7 or 8 years. Autism evaluations are really 80% of what I do. I can do those virtually for kids 4 and under typically. And so that means we're hopping on something like Google Meet or Zoom, and I'm taking you through a series of things that research supports help us diagnose autism, or we're doing it in person. I also help families after a diagnosis is given, regardless of if I did the evaluation. I'm helping you understand the diagnosis. And then I do about a 6-series kind of session package where I help families kind of cope with that and build skills and kind of help their relationship with their child after that diagnosis. Next slide. All right, handing it back off to you.
Okay, so as Dr. Sarah just mentioned, once you receive an autism diagnosis, you probably have a lot of questions. And so when you are having that review of the results review and you're receiving that report summary, your provider should be sharing with you information about services that, based on your child's skills, they think you could benefit from. So this might include applied behavior analytic therapy. And so with ABA therapy, this is a service that you might receive, as low as 10 hours a week, but also up to 40 hours a week, again, based on your child's needs. Your diagnostician might also recommend speech therapy if your child has communication delays, in addition to occupational or physical therapy if your child's also showing motor delays. And then, as Dr. Sarah also mentioned, they might recommend sharing this report with your child's school so that your child can access additional services in that setting as well. And then your report might also have some resources related to counseling or social groups for you and your family, because getting your child therapy is important, but it's also important for you to have those resources as well to connect with other families and to make sure that you're able to kind of talk with others going through the same experience. So, we want to encourage you, take some time to talk to your diagnostician about what services they recommend. Don't be afraid to ask for referrals. So, in your area, do you know anyone that provides ABA, speech, OT? And then, if you need assistance getting enrolled, that person might also be able to help you get connected with those services so that your child can get into that therapy as soon as possible. So next, maybe there we go. I want to share just a little bit about our services at MeBe. So, at MeBe, we are all about helping your child to be me or be the best version of themselves. And so we are a national company. We have ABA, speech and occupational therapy in several states. You can check out our website to kind of see the specific locations. We do provide both in-home and center-based ABA, as well as in-clinic speech and occupational therapy. And then I am starting to open in the next couple of months a diagnostic clinic as well in Dallas, but we will also be able to provide diagnostic services in Austin and Houston as well. So just to kind of share a little bit of information about MeBe and what we might be able to offer your family. And again, we want to make sure that you're able to access the services that you and your child need. So once you have this diagnostic report and an autism diagnosis for your child, again, you may be saying, well, what do I do next? So kind of next steps will look like obtaining some of those ongoing services for your child. And again, it may be one of those services I just talked about, or it might be several of them. I also want to touch on that, and this is something I think that has started to, I think, increase in the recent months. But many insurance providers, once you receive that initial evaluation, may ask you to get an updated reevaluation approximately every 3 years. And so you may say, I have this diagnosis, why do I have to go back and get a new one? And so insurance uses, so with a diagnosis of autism, most providers should be giving you a severity level. And so that severity level maybe a level 1, 2, or 3, and that depends on the kind of severity of deficits that your child might be displaying. And so insurance company every few years wants to look at that severity level. If you're receiving services, it may start to decrease. And that is how they're making decisions on number of service hours that you're able to receive for your child. So, your ABA provider or even speech or OT may also ask you or say, hey, it's almost been 3 years. So they may also ask you to schedule this reevaluation. So don't be concerned if they ask you to do this. This is just something that insurance is going to require. And we want to help you get that so that you don't have any break in the services that you're receiving. Once you receive this diagnosis as well, we also want to encourage you to just kind of think about some future risks. So if you have one child with autism, there is research that shows that there is an increased risk of having additional children with autism, approximately 3 to 10%. There's also a lot of research that suggests that early intervention is really important. So when you get that evaluation, and we've been encouraging you, if you see those delays, talk to your pediatrician as soon as possible, get that evaluation, because the earlier that your child starts services, again, whether that be ABA, speech, OT, PT, the better their prognosis is going to be and the quicker that they're going to be able to make progress. So, get those services started as soon as possible. And now I'm going to turn it back over to Dr. Sarah.
All right. So I think it's important to know how processing the diagnosis may go. And really every parent is different. I've put a couple of things here that I feel like are important kind of takeaways. Be patient and kind to yourself. So like I said, the results discussion and even the report can be an emotionally packed experience. And I don't want you to feel discouraged or scared if you are about to go through the evaluation process. The evaluation is still really important and critical for your child. But I think it's also helpful to know that there could be a lot of feelings that not only that day that you might feel, but that could continue for a period of time. And that's you processing the diagnosis. And it's almost like stages of grief is what some parents tell me. So whatever you're feeling is okay. Be kind to yourself. I think it's important to be patient with yourself if you're, kind of struggling to understand the recommendations, or you're just not feeling ready to take those next steps for whatever was recommended. That's okay. I usually encourage parents to take even a week or two to kind of sit with the diagnosis before they pick up the phone and try to find providers, because it can also be a hard process to follow up on those recommendations and call people and find the right fit. And so you really want to feel ready for it. And a big part of that is taking that time to kind of sit with the diagnosis. Some parents, it also helps them feel better if the day of the diagnosis, they're picking up the phone and they're trying to find people, because it helps them feel like they are doing something actionable and making progress towards those next steps. And that's totally fine too. I encourage you though, that if you do that, make sure that you're also taking the time to think and process about the diagnosis while you're doing that. Many families also say processing is a journey. So when I worked in center-based ABA and was able to diagnose and then follow children over a period of a few years, I would see that process in parents. And, I think that that's normal, and I think that that's okay. Lean on friends, reach out to people, find the community of parents or other people that understand your journey, and that will also be helpful. Next slide. So these are some resources that might be helpful after the diagnosis. Don't necessarily need to talk about them, but just wanted to help you feel like you had some kind of takeaways with this. I think that the websites especially can be really helpful. Books, I think, especially after the diagnosis, can be helpful. And there are a variety of ones out there that really may help you understand your child's diagnosis, especially if they're written from the perspective of other parents or, autistic adults from that community, and kind of, it's just different information. So I encourage you to seek out a variety of resources. If you feel like there are additional ones that you need, you can always reach out to your diagnosing provider or any therapy providers that your child has as well. All right. So we've got a few questions. Dr. Logan, are there participation certificates? Oh, you're muted.
There we go. Sorry. I do not think there are participation certificates, but I can double check on that, and I can write down the name of that person that asked. So, but I don't think we give participation certificates for this.
Sounds good. If y'all have any other questions, I'll answer or Dr. Logan and I will answer the two that are on there. But if you have any questions, get them in the next minute or two, and that will be helpful so we don't run out of time. Do you want me to speak to diet, or do you want to speak to it?
Oh, sure. Either one. And I was going to say, so at the bottom of your screen, if you are trying to ask for a question, you should see a little box that says chat. And so if you have a question, just click on that chat box. It should let you type in your question and you can submit it. There's also a Q&A, so we'll see that pop up as well. But yeah, just in the next couple of minutes, if you put any questions that you have in that chat box, we can go through those. And yeah, I'm happy to answer the diet question. So, and I'll just read it. Oops, sorry. I'm trying to get my chat box back up. So we had a question about diet helping with symptoms of autism. So, it looks like Anita read that, sometimes limiting milk consumption can help with language development. So from the research that I have reviewed, the only times that I see where changes in diet can lead to improvements in either behavior or communication can be if that child has a medical, issue with that specific item. So, if your child has an allergy to milk, so maybe they are lactose intolerant, potentially due to feeling ill or having stomach issues or problems like that, because they can't, their body can't process that. If they have a medical condition like that, we might see increases in challenging behaviors. So things like tantrums, especially if they don't have communication skills. So if they can't tell us that they don't feel well, if their stomach hurts, it might be making kind of their whole body feel bad. Those are areas where I would say that we might see improvements with maybe limiting that milk consumption. So not that it decreases or removes that diagnosis of autism, but if they have that medical condition, we might see some changes in their behavior. But other than that, and Dr. Sarah, you can jump in too. I don't have much research that really supports just reducing milk or even wheat or gluten that would improve those symptoms of autism outside of if that child has a medical condition where they can't consume those items.
Yeah, and the only thing I would add to that is that it's hard to do research on those types of things, and so there won't be a lot of research. Parents have asked me, what about gluten? What about, certain dyes and colors that are in food and things like that? And it's hard because we just can't research it very well. And so I don't know that we'll ever have evidence necessarily one way or the other. What I tell parents though, is that you're welcome to talk with the pediatrician and say like, hey, we want to try this and see what happens. Do you support us in doing that? And how can we do it safely? And then, anecdotally, we might know what works for your child and what might not. And then we have one more question. Can you be diagnosed if your child is meeting all milestones, but just has behaviors like tiptoe walking, echolalia, or hand flapping? And I'll start with that one, and then Dr. Logan, you can jump in if you have anything to add. The short answer is yes. So not all children with autism have significant developmental delays. And so I would say, though, that we tend to see maybe some splinter skills or splinter kind of areas of need. And so I would still say that even though a child seems to be meeting all milestones, there are likely still some challenges with some subtle things like maybe some social skills for their age, and not only, you know, do they have language, but are they having conversations, you know, and how are they using those skills that they do have? Yeah, anything that you would add to that?
Yeah, I was just going to say, so to get that diagnosis of autism, it does require that your child has kind of meets criteria from two main categories. And one is that communication and social skills. And then the other is that restricted and repetitive behavior. So they will have to show some symptoms from those two areas. And so, you know, if they are showing several restrictive and repetitive behaviors, you know, I would say it's probably likely that there are, you know, in some way, some communication or social delays. It might, you know, be small, but those might be present. So, you know, if your child has symptoms from both of those categories, then they would qualify for that autism diagnosis.
Yeah.
And then I see we have, you know, someone that I think is raising their hand, Margarita. If you can just use that chat box, we can't turn on your voice or your video. So if you can either type in the chat box or QA, if you have any other questions, we'd be happy to answer those. And we'll maybe give everybody just one more minute if there are any additional questions. Oh, there we go. Let's see. Oh, okay. She said, sorry. Okay. She didn't see her hand up. So, okay. And I think I saw your question. So I know, so you said, you know, you're trying to get started with speech OT and ABA for your almost 3-year-old son. Waiting can be a process, and it can be really challenging when you know your child might need that diagnosis or they might need access to those services. So I'm excited to see that you're trying to get enrolled in those services. Insurance, you know, sometimes insurance can take a while to process and to for you to be able to get started in those services. So, you know, keep waiting, reach out, you know, if there are any social groups in your area or if you need any other resources, let Dr. Sarah or I know so that we can, you know, connect you if there's any additional resources that we can help you with. I don't see any other questions at this time. So thank you all again for attending this webinar. Please follow up if you have any questions. You can also follow us at MeBe Family on both Instagram and Facebook to stay up to date with our free webinar and events. So we do one of these every single month, and they are free and available to anyone. So if you have any questions, just reach out to us, and we hope you all have a wonderful evening.
Bye, everyone. Thanks.
Thanks, everyone.